Hospital, and I've been helping to lead the 5210 healthcare work that is going on across the state. This is our agenda for today. We'll start with some introductions, and then we'll kind of review what we talked about at our last meeting about the 5210 Healthcare Champion Network, what the roles and opportunities are for folks that are part of our group. Then we'll review the progress on the recommendations that came out of our last meeting, and Becca will give us an update on that. And then we'll give you an update on the current 5210 healthcare work that we're doing here at Iowa Medical Society, and give you updates on the current efforts and resources. And then finally, we'll move on to the multi-sector work that's going on with the 5210 Healthy Choices Town efforts across the state. And so we'll keep you updated on all the work that's going on in all of the different sectors. So why don't we get started with introductions? Just share your name and your clinic and your location, and maybe a little bit about your involvement in 5210 Healthy Choices Town efforts in your clinic or community thus far. So I know, Amy, you're on the call. Do you want to go ahead and start?
Sure. So it's Amy Kimball. I am down in Winterset in Madison County at Health Trust Physicians Clinic and our rural health clinic here, and also involved in the state AAP chapter and national chapter as well, and definitely just got involved in the 5210 mostly through my connection with you, and then with AAP, and just trying to expand that, working with our schools down here, just raising some awareness, and then trying to expand, since I'm the only pediatrician down here, working with our family practice counterparts to help integrate that into their work with children and families.
Thank you so much. Is there someone else on the call? Looks like we've got one person that might be on the call, but they might be on mute if they're not able to hear you. So go ahead and jump in if you're able to share information about your group, but we're happy to have you on the call as well. So just to give you an update of the community, so in 2019, or 2018, just the 2018, the communities listed on the left of the screen there are the initial 5210 funded communities through the IDPH funding. And then in 2019, on the right, you'll see the communities that were funded last year. And so we are coming up on the next fiscal year. So the fiscal year for IDPH runs July through end of June. And so we're coming up on this next cycle. And I think the new communities will be announced early next week. And I think there'll be a number of different communities. So keep your eyes peeled for the announcement about the new funded communities. That might be out on Healthy State website or the IDPH website, but I think there'll be a press release on the new site. And so it'll be an exciting opportunity for us as healthcare champions across the state to be able to help reach out and support folks who are working on 5210 in each of those communities as well. So we'll be talking more about that at our next meeting, but excited about the new round of communities that will be on board with 5210 communities. The other thing that's a little bit different this year compared to last year is that they will be doing an orientation on August 7th, and IMS will be participating in doing some technical assistance for the Councils on Government where the funding goes, and they help manage that grant work across their communities and networking with healthcare. So we'll be able to network with those folks and offer our support from Iowa Medical Society and how do we help reach out and engage the healthcare providers and know what's going on and the different opportunities and resources that we have available. So that will be coming soon. We wanted to keep you aware of that effort. The second part that I wanted to go through after our introductions was just to review again our work here at 5210 Healthcare Champions. The network is basically a way to engage folks that are engaged in 5210 in your clinical setting and quarterly conference calls so you can stay up to date on what new resources are coming out from Iowa Medical Society, as well as keep you in touch with and allow you the opportunity to input what's going on in the larger multi-sector efforts, because we're meeting with those folks from the INS perspective to show to represent the healthcare needs and the work that's going on around 5210 across the state. So your input and feedback is really important to help shape this program and make it successful and sustainable long term, because if we're meeting the needs that you have in your clinic, and we're building support and your skills as champions to be able to share that with others, that's going to be really important to long-term success. Any questions about the champion network? Amy, were you on the last call? Okay. So this might be new information to you.
I'm trying to think if I was on the last. I think I was on part of the last one and then had to leave or something. But yeah, it feels like it's been a little while since I've been on one, so I may have missed that last.
We'll be back in February. So any questions about those webinars?
No.
If you're called in or you're on the webinar?
I think I was on the webinar for that one, I think is what, but no, and I think I was on that, so.
Can you see the slides today?
Yes, yeah.
Okay. Sounds good. And so let's just review kind of what we talked about in our last meeting. Something you want to kind of go through that slide?
Yeah, so basically these calls are set up to really create that champion network and get guiders champions.
Sorry, I have to introduce yourself.
Yeah, I'm Dr. Springberg, and I work with IMS, the manager of major initiatives, and one of them being 5210, so I manage the registration and organizing what goes out and coordinating technical assistance meeting, and also keeping up to date with like our website, calendar DC page. So it's a whole different assortment of things with our clinic. But so last call we had a lot of people wanting improvements and making your expectations on what our website looks like. So we kind of did it in slow process, but the webinars are all fixed. They weren't correct, they didn't have correct links, and they weren't really well organized. So now they're set to be like the core 5210 like onboarding webinar, and then there's a slew of additional webinars that we had outside providers come in and host. So there's tons of resources, free ones online that we go back and check out. Someone also requested having access to like a listserv of physicians or pediatricians in their area or in their state, wherever that may be. So just so you guys know that is available, that's out there, just email me and I can pull an IQA for you and get you any providers that you need that you might want to be in contact with, or if you want have like a letter or you free go out of like referrals for 5210, we have that. So what else is there? Oh, the Healthy Habits questionnaire that is not already on there, it's already pulled out of the Spanish and English version to just have the Healthy Habits questionnaire pulled out from the actual toolkit.
So on the bottom here is a link to the WWC website, and so maybe bookmark that on your browser so that you have access to that, and that's where we'll be making updates, and as we develop new tools, that's where that will be posted. So if you get a chance to check it out, just shoot Becca and I an email with any feedback for improvements. We're able to make those pretty quickly, and so we'll be making sure that this is kind of as good as we can get it prior to the August 7th training with the pods, and so any feedback you have would be great. And then I think we have one more person join the call. Two more folks join the call. Dr. Alexander, I think that you're on. Would you be able to just introduce yourself where you're from and just a brief about the 5210, your involvement with 5210 in your clinic?
Can you hear me?
Yeah.
Oh, okay. I can't tell. I'm still a little technologically challenged here. I can't get my phone to work, so I couldn't tell if I was in or not.
Sounds good.
Sorry, I'm having some echoing there. Sorry, did you say you just want me to introduce myself?
That'd be great.
Oh, yeah. So this is Jill Alexander. I'm in Ames, and we have been using the 5210 for, I think we're at least maybe in our second year now, maybe our third, but we love it. Have been using it and doing well with it.
Great. And then I think we had one other person join the call. Would you feel free to introduce yourself? Sounds good. Well, I think we maybe have another caller. If you get an opportunity to, maybe you might be on mute because we're not hearing you. Feel free to jump in and just introduce yourself. We'd love to hear from you and know who's on the call. So we just reviewed kind of what we talked about in our last meeting, our first meeting of this Champion Network in February, and Dr. gave us a nice update. So we'll move on to give you an update of kind of the work that we're doing on in regards to 5210 healthcare. And so the tools that we have already developed, you're probably familiar with, is the webinar series. So there was a series of 4 webinars that we have been doing when we started the program locally, and we made those into webinars so that they were available for folks statewide. So they're still available on our website, and you're able to get CME or CEU credit for viewing those. So if your clinic would like to view those and would like to credit, just send Becca an email, and she will give you the details about how to, what steps you need to take to get the CME and CEU credit. And so those trainings involve, the first one's kind of a brief overview of 5210. There's one on accurately weighing and measuring pediatric patients. That's been really well received by a lot of clinics. That was just like a nice review for their staff on how do we do best practices around getting accurate weights and measures on kids, because you know it can be tricky. There's one on motivational interviewing and brief action planning, which is really important. So those are special conversations around using the Healthy Habits questionnaire. And then finally, there's one on stage 1 and stage 2. So what do I do with the results of this, of that screening questionnaire? And it has some information about links to community resources that are statewide as well. And then in January of this year, throughout this year, we've had a series of different speakers from across the state that were able to weigh in on comorbidities in childhood obesity, nutrition recommendations in regard to children. And so Dr. Maren Wolf from Iowa State gave her nutrition recommendations. Dr. Sean Spooner, Community Point here in Des Moines, gave information. He's a sports medicine doctor, gave information about physical activity recommendations. Dr. DeMayo gave a nice lecture on non-alcoholic fatty liver disease, and he's a GI doctor here at Mercy in Des Moines. And then Dr. Paisley from Grinnell, she's an obesity medicine med-peds doc over in Grinnell running a pediatric bariatric program. And she gave a great talk about bariatric surgery and stage 3. And then Dr. Helena LaRoche is from the University of Iowa. She's a, I think she's med-peds as well, but a researcher over there that does community intervention research. And so she talked about community resources. That's what a lot of her research involves. And then the endocrinologist from the University of Iowa gave a great talk on type 2 diabetes, and that's Curtis, Dr. Vanessa Curtis. So great to be able to get lots of our experts across the state involved and engaged. And so those are also all recorded and up on the website for your use as well. We also had, last year, we received a grant from AAP, the Institute of Healthy Childhood Weight, to be able to bring together stakeholders to revise named 5210 intellectual or developmental disabilities toolkit. So we know that kids with intellectual and developmental disabilities are at increased risk of obesity. Maine had a great toolkit, and so we were able to bring together stakeholders to let them know about the toolkit, make revisions so it's applicable to our state. So some of the terms and definitions of what's used in our Department of Education is different in our AEAs, and so that resource is available. If you're interested in getting a copy and don't have a copy, please email back to us. We have printed copies that are available for anyone. And we also did a webinar that's up on the website as well, kind of talking about the toolkit. We had somebody from the Department of Education as well as Melissa from Courage League Sports talk about some of the content. So it's a nice overview. So if you have an opportunity to share that with folks in the community who can use that, that would be great. And let us know any feedback you have on that. Those, and then we also have the Healthy Habits Toolkit, which is 9 patient education handouts within a model of how do you work through brief action planning and motivational interviewing in discussing these topics. So it's really kind of a toolkit to do that stage 1 and stage 2, those follow-up visits after you, for kids with elevated BMI and whose parents are ready and interested in change and wanting to work on some small goals. So that is available online as well. We do have a few printed copies. If you're in need of more printed copies and interested, please let us know, and we can look for printed copies that are available or find funding to be able to get you additional ones. So that's kind of the group of resources that we have. Our webinars, the Healthy Habits Toolkit, the Intellectual Developmental Disabilities Toolkit, and all of that's available on our website. And then to give you an update on kind of where we're headed for this year, there's a few different things. So locally here in the Des Moines area, I applied as a pediatrician in Des Moines with help from Blank for a CATCH grant. And so that CATCH grant will allow us to bring an evidence-based program to the YMCA, so community-based childhood obesity intervention program to the YMCA here in Des Moines. And the program is called ACT, Actively Changing Together. We're hoping, we've partnered with Community Health Partners, which is they do a lot of the medical programming within the YMCAs, and so they are great partners, and are hoping that this small grant and pilot year will then be a launching point for a sustainable program in Central Iowa, but also that will be able to be spread to other YMCAs and fitness facilities across the state. So keep your eyes peeled for more information about that. We're hoping to be able to launch that, so the first session would be in January, and then we'd have a second session probably starting in April. And so we'll keep you updated, but that's a highlight of some work that is related to the work we're doing. Additionally, we have work going on around focusing on how do we intervene even earlier and help prevent childhood obesity even earlier. We know at age 2, a lot of our kids' patterns of eating have already been established. So there's a lot of work from national AAPs as well as in other groups similar to ours in other states around how do we focus and give parents anticipatory guidance and intervention even sooner, so both in the birth, prenatal actually, to the 2-year stage. And so we're working with some folks at the Maternal Child Health on some projects they're doing, but stay tuned because hopefully we'll have a questionnaire that might be able to be used in our anticipatory guidance, like at the birth to age 2, so like a healthy habits for the under 2 is what we're looking for, a questionnaire that could be used in that setting, as well as, resources, anticipatory guidance, as well as educational resources to be able to support, interventions and what we do as a result of that questionnaire. So that early 5210 before age 2 is kind of in the works. The other thing that we've just got notification of is Iowa Medical Society, the 5210 Healthcare Group, is applied for support from IDPH to develop a resident training program around 5210, so a curriculum that can be used at pediatric and family practice residency programs across our state to be able to educate new providers coming out of those programs about 5210. So that project will be getting started here soon and will be completed by June of next year. So if you have interest in helping to contribute to that project, please email Becca or myself because we will definitely need a group of folks who are interested in helping to support and develop that curriculum, and so please give us an email and let us know if you're interested.
You know, for getting back as far as creating.
The other thing that we're working on is the action guide. So that was attached to this agenda. And so for the other sectors, the Healthy State had developed an action guide for child care, or for schools and early childhood studies on how to get started with 5210. And so that is what we just revised that, and for use in healthcare. And so there are a few additions or addendums that we have made, or revisions we've made since we sent out the initial email to you a couple weeks ago. So I would love feedback from you guys, and maybe, Jill, do you have the website up, the webinar up, or do you just have, are you on the phone? With Amy and Jill, I'd love for you to give us some feedback about your thoughts about the program, about the action guide, and I can pull it up here so you can look at it.
Yeah, I have the webinar open and the phone. I think that's why I'm getting double and I'm having a hard time hearing. But I have the action guide up too, because I think I got it via email.
Okay.
And this is the action guide. I've got it up as well, so thank you.
Okay. So here's the action guide. I'll try and make it bigger here. So this is the first page of the action guide. And then the second page talks about just a brief overview of what 5210 is. And then page 3, which might be different than what you've got up, has the why 5210 works, and it's kind of the evidence behind each of the different messages. And then page 4, it has the 10 strategies of success. So this is what all of the other sectors are working on, as in changing the policies and the environments that surround kids wherever they're at, in the school, after school, early childhood register sites. So they're committed to implementing strong policies around these different sectors. So in regard to healthcare, the piece is that we're obviously talking to our families about these strategies when we're going through the Healthy Habits questionnaire, but also, you know, there's opportunities for us as healthcare providers to engage with our communities or advocate at a bigger level about the importance of healthy eating and active living. So some of that applies to us too, so we felt like it was important to include this in the action guide. And then finally, how can you help? It talks about how our role as healthcare providers. So this is different than I think the page that you guys had. It talks about that we look to our healthcare providers for trusted advice, and hearing the message in their healthcare clinic also reinforces what they're hearing in other settings. And that, you know, we talk about how we can lead in this work into our daily practices, and that the toolkit supports our healthcare team in our clinic, and it talks about the 3 goals. And then we mentioned that you have access to free resources for staff and families, personal assistance from our healthcare team, and then additional training opportunities such as webinars and workshops. Any feedback or thoughts about those initial pages on the guide?
I like it. I think it's pretty straightforward. It's pretty simple. I think it's great. I like it a lot.
Okay.
Ms. Amy, I would echo that, especially like kind of the examples of the implementation. I think sometimes, you know, people are like, oh, don't even have an idea of where to start, and that gives a really good guideline as a place to start. So I think one question that I know we have had come up is if, you know, if a local school is interested in this and kind of initiating versus a clinic, do they do that as a joint? Do they do that as two separate? And what's, I mean, you know, our thought has kind of been to have the healthcare facility be the center of it and then partner with the school, but we've got some communities around that the schools don't necessarily have a direct line to a healthcare facility that are a little bit more remote, and so I don't know what thoughts are on that direction of what's the best way to work with them or to how to outreach to them the best.
Awesome. That's a great question, and a good point is that making sure, so I think it's newer this year that now schools can register 5210 sites, registered sites, child care centers can register, and then before and after school programs like at the YMCAs or after school programs in the communities can register as 5210 registered sites. And there is some technical assistance. There's an action guide that's really similar to this, but really targeting those other settings that Molly Gostin, who is the contact at Healthy Estates, will connect schools once they fill out an online registration. So I guess the best thing to do is to direct those. Yep, so we can connect you with Molly if you've got schools in mind, and you can forward their email to them, or you can direct the site to go to the Healthy Estate Initiative 5210 website, and it says register, and there's a site for schools to register, as well as all those other sites, and then Molly sends them an email. Erin from IDPH sends them the registered site decal, and so all of you should have gotten a 5210 registered site window thing. So if you have not gotten one, just email Becca and we can get one in the mail. So you can get that on the window of your clinic to get recognition, because people might be seeing those at the other registered sites. The other thing that's new is that there's a workplace setting as well. And so businesses can register, and so there's a whole action guide for them, because again, like healthcare, it's a little bit different than the other settings, but there's an action guide for them too. So maybe making sure we have clearly demarcated in here how other sectors register would be good to add.
So have any of you got in specifically? Oh, sorry.
Go ahead.
Oh, I was just going to ask, have any of you gone in specifically to ask a school to get started and register? I guess I'm interested in trying to get my school to register, but the food snack is the one that's get some pushback on. But has anyone personally had experience going in and advocating for a school that's not asking you to come? Like to invite yourself and go?
Mine has been more of a cooperative conversation, I guess. It's just kind of come up when we were talking about other things, but there definitely are some schools in the area, and I guess what I was hoping and planning to do was, if I can get the schools that are interested in it to also help advocate to the other schools that are being a little more resistant. So I guess my thought was to, because I'm not as connected with those schools, and so then I feel like I'd just be going in as some random person, and I think sometimes the schools are more connected. So I think maybe, I guess at least my plan was to try to utilize or push the schools to try and help each other, I guess.
Got it. Okay.
I have some experience working with the schools, like my local school, just personal relationship with school nurses at some of the buildings, or PE teachers about, what are your goals around wellness? Is it something that would be of interest to you? And so when they register, they fill out a little survey, but then they also are eligible for the Healthy Estate Initiative Awards, which are monitoring awards that their school can get. And then I think that they're working on similar types of awards for child care as well. And then there's recognition levels. So for healthcare, it's either your registered site, if you meet all three goals, in your site of distinction. There's like gold, silver, bronze level for the schools, because there used to be a federal program that did that and it had those different levels, but that program went away. So they tried to make this in programs that can kind of fill in that gap and still support folks. So I think that we'll probably add maybe information about where other sites can, if your school would like to register or you'd like to tell them.
Anything that wants to register with no LASD website.
So we'll add that maybe to page 4. Any other thoughts or comments?
This is Amy. I think that would help. I think one of the things that I know when I kind of looked at this with some of our staff here was that, you know, that puts then the healthcare facility kind of responsible for the whole community, and I think it's, you know, obviously a big source, but I think having that other information, how other entities within the community can be signed up would be helpful, just to kind of maybe alleviate some concern of this is only going to be on the clinic or only on the hospital to do this, and so because that's obviously not going to be available in every area. So I think that would be great.
And I think that what I've seen in some other communities is they have like a health coalition that at different levels of activity. But sometimes those groups are interested in learning more, and so opportunities might exist where you could go as a healthcare provider to talk about 5210 and the work that and how that's impacted, you know, like the work that we're doing in our clinics, and then just mentioning that there's opportunities for other sectors and to get involved and then giving them the resources. So that's really helpful to know. And one of the parts that we wanted to develop was as part of this Champion Network was that we'd be able to support advocacy efforts of our champions across the state to make it easier for you to engage your community like you've already been doing, Amy. So that feedback is really helpful about having it maybe a letter that you drafted to the school that you could just, a TM letter that you could use to be able to share with them or a brochure. Awesome. So like on page 6, we talk about implementing in the clinic, and so I'd be interested to see if what we're promoting the clinic to is what works for your clinic. So, you know, we talk about engaging a healthcare champion and team members. So one key contact at the facility as well in the clinic and team members, having somebody sign up online, and then reviewing goals and developing an implementation plan on page 6. And then sharing. They also really want to be able to capture stories about how this effort is making a difference. And so if you have pictures of a healthy day, or if you've got a t-shirt day that you guys are doing at the clinic for 5210, you can take pictures and share that out on social media if you guys have opportunities to do that through our health system. And then checking in and getting recognized. So that's basically refilling out the annual survey. And so then there's a one page on each of those steps that talks about registering, recertifying every fall, the role of the team. Because like at our clinic, you know, if we run out surveys, then the paper surveys, then they don't get done for a while. So having a team that's kind of responsible for checking in and making sure that everything's still going has been helpful for us. Talks about registering and implementing, and this is the implementation guide. Because a lot of the other sectors of the work focuses on policy systems and environment change and action planning around making those changes. So what's something analogous for the work that we're doing in the clinic? And this is the kind of implementation guide that we came up with. Of what steps do we need to put up the posters? How many posters do we need? Is there any additional training to educate our staff on what resources do we need, and we can track our progress. So then we have a sample one that we filled out below that kind of gives people ideas of what things they can put into those areas. So part of me thinks, are we making it more complicated by making it an action plan rather than just focusing on the 3 goals, or is it helpful to have kind of a more systematic approach to implementation in the clinic? So what are your thoughts about that?
I definitely think that having an, oh, sorry, go ahead, Amy.
No, go ahead, Jeff.
Well, I was just going to say, I think it's definitely great to have an action plan. I think, like anything, we all want to get started, and we don't really know what to do, how to get going. So I think it's great.
Yeah, I would agree, and I think it also helps define roles and gives so that it's not just on one individual. You know, I feel like once you have an action plan, then you can assign duties, and it helps delegate a little bit better, and it gives people something to go back to as a framework. So I think it actually makes it a little less overwhelming by having that sample out there, because it kind of shows that this doesn't have to be rocket science to do this. So I think it's very helpful.
Okay. Awesome. That's great feedback. The final two parts are just checking in and outlining that to get site and distinction recognition, you have to indicate that 100% of your providers are meeting all three of the goals. And we listed out the goals so that it was easy to see. Sometimes what we found was when people were doing their annual survey, if posters fell down, people were reluctant to say that they were district-wide in all 100% of the site of the rooms. And so we don't want clinics that are doing all this amazing work not to be able to be recognized because of, misunderstanding the question. So that's what this check-in is, just to clarify the site of distinction. How do we get recognized as a site of distinction? You have to answer the 100% of providers are doing all three of those things. All right. Anything we're missing in the guide, or any final thoughts about?
My biggest thing is trying to get the advocacy piece involved. I think there's a lot of people that can really take this to heart, and we don't necessarily need to do it. We just need to get the seed planted, and I guess I'm figuring out that in my community a little bit more. But so if anyone has had some great success with something, let me know.
For advocating outside of the clinic, you mean?
Yeah, and trying to, get the schools on board and get people on board and that kind of thing.
Sounds good. So one of the things that I'll mention here too is the 5210 Summit. So this year, this is the second annual summit that will be held on October 22nd from, I think registration starts at 8:15 and the programming starts at 9 and it runs till 3 o'clock. So if you would be interested, I think that if you're interested in advocating, it would be great for what you're looking for, Joe. It has the agenda this year will include the keynote speaker will be Laura Perdue. She is from University of Minnesota Extension, and she does a lot of work around community systems change and policy, CSC work is what they call it. And so she'll be the keynote speaker, and then WellKids Coalition, which is our Central Iowa Coalition, we did a presentation for the public health conference, and it kind of talks about and gives examples of how do you build coalitions, how do you sustain them, what kind of support is needed for that, and to make community change, and how do you partner across the silos. And so that'll be the second component. And then the next section will talk about community examples. So Nathan City was one of the funded communities this year, and so they will be talking about the work that they did and how they partnered across sectors. Then there'll be lunch, and then there'll be 2 breakout sessions in the afternoon. One is nutrition, and so they're still working on solidifying who will be doing the programming, but it will be actually in a cooking classroom there. The summit we call it CMU, and they have a cooking classroom, and so they'll be doing some examples of nutrition programming that's hopefully available statewide. And then there'll be a physical activity programming with Melissa from Courage Sports. We'll be talking about how do we engage kids and make adaptations for kids with disabilities. And then finally, there'll be kind of sustainability, building strong foundation for ongoing 5210 work across sectors and communities. And that will be led by Katie Weeks from Iowa Medical Society, who does a lot of great work around finding grants and building support and strategic planning, and so she'll be talking about some of those components. And then, so that'll wrap up about 3 o'clock. And so I think that if you have availability and to come, it would be awesome to have you here somewhere in the morning. And then we'll be getting CE and CEU credit. So So that'll be available for folks to attend as well. And so spreading the word to folks that you know that might be interested, if there's folks with your health system. So we were thinking that this might be of interest, the programming this year, to providers, but as well as care coordinators to learn more about community resources, because there'll be a lot of different community resources that we can connect our patients and families to there as vendors. And so we're talking about trying to figure out a way that we can collect that as a resource guide moving forward. And then perhaps also a lot of the health systems have community outreach departments or community benefits, I think, departments. And so some of the folks working on that might be able to learn a little bit about the 5210 work and how can our healthcare system support kind of our communities in this work. Any thoughts about the summit agenda? Go ahead.
So that was the 22nd of October?
Yeah, it's a Tuesday, from 9 until 3. And I think you send out the save the date card.
We send out the posters on our website, and I don't think it's on our newsletter yet, but it will be during the fall.
Yeah, so we'll keep it. I think we do have it on our Capital BC webpage, is the link, and so we'll have the save the date card, and then we can link it to the registration we'll have and stuff. So that'll be an easy way to find it as well. One of the opportunities that we're working on and hope to be able to have available is a brief action planning workshop or visiting speaker that could come in around the time of the summit. So one, would you be interested, or do you think there would be interest around getting additional training in brief action planning or motivational interviewing? And it's really targeted to healthcare providers.
Yeah, I'm interested in motivational learning. I thought at one point there was going to be another conference, and I can't remember if it happened on a day I couldn't go, or did that one happen?
There was one in down here at Blank that we held, but there wasn't a lot of advance notice, so that's what we're hoping to maybe put it on around this time of this conference, so maybe the day before or the evening session where we could at least she could give a lecture or a brief overview of it to some degree. Oh, yeah. So we're trying to figure out would there be enough interest to try and link these two, because I know it's time out of the clinic, and so we think that it's important enough to folks. So I'll definitely keep you updated on, even if it isn't around this time, we'll send it out as an opportunity for the network to do the brief action planning, because it may be that we may have to do it earlier than when this conference is. But it's great to hear that that's something you're interested in. What are your thoughts about any of your colleagues you think would be interested in that, or is that tough to get out of clinic for? The one that we did at lunch was actually a 3-hour training, and it was kind of hands-on experiential, so you actually practice some of the skills that they were talking about.
Yeah, I think probably like all of us, the hardest part's getting out of clinic. I already looked at October is already, yeah. So I think it's the hardest part's just getting out of clinic, and when they are.
Yeah, I agree. I think it's that, and so I think as much as can be connected so that it's not multiple days out of the clinic, and especially like that week is NCE at the end of it, so anybody that's going to NCE, then, that kind of so kind of that overlap too. But I think the training is important, and so I would say, being able to offer that, and that gives some skills, because I think a lot of people do feel that, yes, it's something I want to do, but I don't feel comfortable doing it. So having that training available, and I would say also just as early as that could be planned and get that information out, because a lot of places it's just hard if you're not months out to be able to get that time allotted to be able to get away.
That's the feedback that I was sharing. So I think our sector is unique in that tons of advance notice is needed to be able to get folks to be able to participate in some of this stuff, and so that's different than most other sectors, and so that's a challenge, but we're making sure that they all hear that as well, so thanks for that feedback too. If there was, if the training's one thing, but then if there was like an opportunity for healthcare providers to network either before, as far as like a dinner the night before, where we could have maybe Dr. Christensen speak or a guest speaker talk about childhood obesity related issues. What do you think would be easiest for folks to attend? Would it be the night before? Would it be the night of? On the same day? Amy, I heard you say maybe as much on the same day would be helpful.
I think either same day or the night before is not, because if people are traveling in for it, a lot of times they're going to be leaving that night before and could maybe make an evening event. And as long as you know in advance, and if there's something that could then have a little bit of an informal networking time would also be really nice, just to connect with people that are interested in this area throughout the state. So I think, the night before or the night of, either one would probably work fine, as long as people, could just plan in advance for their timing of when they needed to leave the clinic time.
Yeah, I agree. I generally like night before. I'll be honest, Tuesdays are almost impossible for me, so when I'm looking at this, I'm like, oh, but that's, we each have our call day and all that stuff. But, yeah, I think in general, night before is good.
And I think sometimes, too, if we do this in the evening, if even folks couldn't attend the conference the next day, perhaps they could come to an evening, at least the local folks, and it's not too far, maybe an evening event if they felt like it was important enough, and wouldn't have the clinic restrictions, perhaps. So, okay, well, we'll get to work on that and see, hopefully in the next 2 or 3 weeks, to be able to get something put together and sent out to make it most likely to be successful, I think would be important. So that's awesome feedback. So I'm going to go back to the slide here. I mean, I think that we talked about current resources. So the statewide update, I think I've given you a lot of the statewide updates. So we talked about the summit and kind of the plans for that, and then the announcement about the new upcoming announcement about the new funded community. And then the other big announcement is that they now have a workplace sector. So healthcare clinics, if you're already a 5210 healthcare site, you could also register the 5210 workplace site. And so some of the health systems, if you have an opportunity to share that opportunity with your hospital wellness or your clinic wellness or health system wellness group, that might be of interest to them. So there's a registration, and then they do an annual survey, so similar, and then there's an action guide about how they can engage around the 5210 method. So hopefully parents are hearing it at work, and then their kids are seeing it at schools and child care, and then they're seeing it in our clinic, and then that's kind of bringing that full circle and doing that whole multi-sector approach across communities involved. And so that was just launched last month, and so they already have a number of sites like that. So that's exciting. And I think right now our numbers for healthcare sites are between 60 and 70 5210 registered healthcare sites across the state, so that's really exciting. And so the goal now is continued engagement, continued meeting the needs of what folks are facing in their clinics. Are there ideas that you guys have about what's needed, what you'd like to see from a healthcare standpoint of support? So you've already mentioned kind of advocacy support, and clarifying how we help support this multi-sector community. Any other thoughts?
I think those would be the big things for me, really. And just always new ideas. I think a way to share ideas from facilities, of what's working in different areas and or what's not worked, and so kind of a share site might be a nice way to have people, and that might be something people could reference if they were interested in signing up but not sure what they could do, share sites that people could tap into to, and it may already be on there, and I think just making sure that everybody understands how to access that information.
I think we've got some lessons learned about the community. Becca's done some of the clinic highlights, and so those go out in, those have gone out. Healthy State pushes those out, so if you haven't, I don't know if you guys are on Facebook, but if you like the Healthy State Initiative website or Facebook page, they push those community highlights. And then Iowa Medical Study has a weekly debrief communication that comes out and has information about what some clinics are doing. So I think we highlighted kind of some of the work you were doing, but ideas about some clinics are doing like 5210 badge holders or T-shirt days, or if they have 5210 coloring sheets, or if they're doing a community outreach event, they're offering the fruit and veggie tracking bands, which are like those little plastic jelly bracelets, and you have 5 in one hand, you move one to the other hand, you can eat if you're a veggie. That's something that's been well received by patients. Or there's a 5-week challenge booklet that Heidi's printed in limited quantities and can be distributed. So is it kind of ideas like that? Is that what you're thinking, Amy, or was it something more along how do we implement this more effectively in our clinic or workflow too?
I think kind of more the quick fun ideas, because again, I feel like a lot of people look at it and go, oh, this is just overwhelming to do all this, and thinking that it has to be a big project. And so kind of those nice quick, just as a reminder, and it just starts a conversation, those little ideas are good things to kind of share, because it lets people see that it doesn't have to be a big monster project.
Yeah, I like Amy's idea of having a place to share it too. I even just, those bracelets, where did you say those were from, Jennifer? Where do you get those bracelets that go from one arm to the other?
So we've ordered them online with some of the current funding that we had at Point to run the program with the Unity Point site. There's also efforts like statewide, people just order them on, and they've made their own. There's a downloadable little cardboard attachment that has the 5210 logo on, and so they order them on Oriental Trading Company, the little bracelets, and then they put 5 together and then put this little paper flyer on. Yeah. So there's a couple different ways, but I think that having access, so in the toolkit, one of the things that we did is 5210 stickers, but there's not a central site where you can order those. But those are the tools that I found most helpful in piloting in my clinic, is I give the kid a sticker with the 5210 logo on it as we talk about it, and ask them if they've seen it before. And so that's, but it's finding out who's going to order those and where you get those orders would be helpful. So maybe giving Healthy Estates that feedback, is there a way that clinics can order those stickers online to get those, or are there ways that we can advocate with our healthcare systems that they support purchasing some of those, or in the funded community, as that funding from IDPH, when you're engaging healthcare clinics, that's an opportunity that some of that funding can be used to supply those things to clinics to help support that work. And that's what, in the Warren County efforts that were going on, we were able to help supply the clinics with some of those bracelets or T-shirts or the badge holders. But that's the way that healthcare clinics and the funding community can utilize some of that funding to be able to help spread the message. But then how do we make that available for other forms of funding to be able to support the state? So that's good feedback too.
I just had one more question. If this was something too that we were going to go in and try to advocacy, do something in our school, and try to get more just knowledge about it. Is it something we can go and take these standard 5210 slides, or is that something that if you're doing on your own, we should just be talking about and directing people to the website, or what's the recommendation there?
So we have a slide set that we've used in certain ways, but there's not a standard 5210 slide set to advocate across communities. But that's something that has been thrown around in conversations, and we can bring back to the multi-sector group to say, is there a standard slide set that if there's a champion in the community that wants to talk about that would be easy to use. So what I've seen some folks do is just either they'll, you can order the brochures online, so they'll just, and there's now a parent education and a teenage education brochure that's online. And we can maybe try and see if we could put that up on our website, reach out to the BC website, and then link it to the place where you could order it. And maybe we could post that on our top of the BC website. It's just a list of all the tools that you could use and how you access them. And then we could put what slide decks or information we have to do the application. To make that more centralized so you can find it. So, no, there's not a current slide set, but definitely I think that there's a need for that, because that was just brought up at a meeting this morning. So that's great feedback. So if you're looking to advocate in the community around that, let me know, because I'm happy to share any of the slide sets that we've done, but just in a school setting, packaging it up for that school setting is something that hasn't been done. And having conversations around how do I talk to my school board? So is there a canned presentation that maybe a healthcare provider or other champion from any sector could bring to their school board to talk about this in their community? And that hasn't happened yet, but I think that would maybe serve the purpose. Were you thinking about like a direct to the children and families, or more for the policymakers at schools to advocate?
Well, I'd be interested in starting with just getting, I can't believe how much food is in our schools as rewards. So that's like my own, I feel like a place that we can make a big difference. And I think that just a pattern like this that talks about what we're focusing on in the office, and this is what we're talking about, and trying to get them on board to decide, oh, we might be interested in this, because if they're interested and they start down this toolkit, they're going to realize that's a big part of it. So that's, I mean, I don't think I'd walk in there and say, I want you to get rid of all your snacks in your schools, but you walk in there and present, this is what we're talking about, and what do you think about getting on board and joining us? And then they'll find that as they start to look into it, I guess, because I don't know you all's experience, but my experience is if it's someone else's idea to join in, they obviously have more success usually. So I'm just interested in starting the conversation, and I don't know whether that's best to start locally at a school, at their, with the teachers, or at the school. I don't think school board. I think it's better school, individual school, and just where to start. Maybe with the nurse is the right answer. I don't know, but I was just trying to figure out what tools there were to get that conversation started for them.
Yeah, so I think that that's good to understand too. One thing I've tried, so one of the policies that was disturbed on my child's school was the water bottle policy. They couldn't bring water to school. They just had to drink out of the faucet. So I had a conversation with the principal, and she referred me to this wellness group that they had to talk about it. I went in asking, hey, I want to better understand the policy, or what are the challenges around access to water for kids. And then that was really successful, and then I did the same thing in the middle school, talking to the principal there and just finding out, hey, what are the challenges we have around that. From a personal standpoint, that was helpful, or that was successful in my setting. But I think it's pretty unique depending on who you're talking to. But there are wellness committees, like there's a SIAC committee, and I think most schools are required to have a wellness committee or a community advisory committee. And that's another place that I think is a great way to kind of partner with schools and get engaged and find out who might be people that would be able to make a difference. But how do we make this information more accessible for providers like you that are looking for that? I think it would be good to work on too. And I think with those networking opportunities, like you mentioned, around the time we can get an evening session, maybe the night before, would be great to be able to share just kind of what's working and what's not. Any other thoughts? Well, I think we're right at 1 o'clock. So I really appreciate your time. We will have another meeting in about 3 or 4 months this fall. We will send out an invite for that. We'll get that on the calendar yet this week. And then we'll also send out the amendments to the invite list for this. If you have other folks that you think might be interested in joining, please invite them. What we found is personal invites from somebody that we know to get involved. If you know they're passionate, please invite them to be a part of this group so we can help spread the word and support each other in this work that we're doing. And if you think of anything else, have any other feedback, don't hesitate to contact us or I by email or by phone. Thank you.
Great, thank you.
Have a good rest of your day. All right. Take care.